We have to put our collective health first and foremost, and the economy will pick up later, but we need to save lives at the moment by keeping people at home.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
All the coronavirus questions you're too afraid to ask, Dr. Hilary is here to provide the answers. And you shouldn't be afraid, actually, because that's exactly what this show is for. Every weekday, we give you the opportunity to ask whatever you want to know about this incredible COVID-19 situation, and Britain's most trusted medic will give you the honest answers. And Dr. Hilary, I actually wanted to kick off today asking about a vaccine. Is it definite that we are going to get a vaccine for coronavirus?
There are clever doctors and scientists, engineers working around the globe to come up with a vaccine to protect us against this horrible virus, COVID-19. Now, it's not easy to quickly produce a vaccine. First of all, you have to identify the structure of the virus, and this is a new virus. You have to find something about it, something about its molecular structure, the outside of the virus with its characteristic spikes, which that's why it's called a coronavirus, because it looks like a crown. Then you have to see if you can find something that will attack those molecules and create antibodies to destroy the virus that is replicating in the human body. So that takes painstaking work. Viruses are such simple microorganisms that actually it makes it harder to find a vaccine than for a bacteria which has got a cell wall. Viruses don't have a cell wall, so you have to find something else. Once we've got a vaccine, we need to know that it's safe. We need to know that it's effective, but we also need to know that it's safe. We've had vaccines before which are only partially successful and some that just don't seem to work at all. The main thing is we find one that's safe and that works. And they're making strides all the time, little steps towards getting a vaccine all across the world. And the hope is that we find one that gives lasting immunity. We've done that for so many lethal bugs in the past, like smallpox and Ebola, but we need to get one quickly for coronavirus, and our hope is that we'll have that within a year.
Well, exactly. So there's lots of hope about the timeframes being much quicker. Why, for example, could we not find a cure for HIV when there's so much confidence from the medical community that we will be able to find a cure for COVID-19?
Well, HIV was fairly unique in that the virus attacked the very cells that normally protect us from infections. Human immunodeficiency virus. It actually caused immunodeficiency. So this was fairly unique. And it was completely different to anything that doctors and scientists had seen before. So it was very difficult to come up with an answer to that. Now, the good news is that now we have antiretroviral drugs which are very effective, and people with HIV now have a pretty normal lifespan and a very good quality of life. That is why we hope that we will soon get an answer to coronavirus, which is much more transmissible than HIV. You know, Dan, that HIV is transmissible only through blood and body fluids, whereas this is a respiratory airborne disease, which is much more transmissible and still pretty lethal at the moment.
Absolutely. Look, your opportunity now to quiz Dr. Hilary, and if you do want to submit questions, you can do so on any social media site using the hashtag AskDrHilary, and we'd love you to ask your question on video as well if you upload a video to any social media platform using that hashtag. First question today, though, from Pamela Mitchell, who says, my husband is an undertaker and I am a carer in a residential home. Is my husband in a high-risk environment while out collecting the deceased? If I then go to work in an elderly residential home, am I putting them at risk?
Well, they're both key workers. Funeral directors should have guidelines as to how to protect themselves. Somebody who's died from coronavirus might be able to spread the virus for a day or two after death. And that's why funeral directors must take precautions so that when they touch a surface of any kind, that they are making sure that they are minimising their risk of exposure. So when the funeral director comes home, he needs to make sure that he has washed his hands, that he's used hand sanitizer, and that he keeps a social distance from as many people as possible. So obviously in the household in which he lives, his significant other he's living with will be exposed to anything that he's carried, and hopefully he's minimised that. So she goes out to work. But we need key workers. We can't say there's never any risk, but as long as people are adopting every single precaution that they possibly can, that risk is kept to a minimum, and people will continue to work under those circumstances.
Next question is from Maria Lyons, who says, if you have coronavirus, would steaming help to clear airways and protect your lungs? I think steaming, that's the thing that singers do, isn't
Inhalation,
it?
yes, and unfortunately not. Steam inhalation is quite useful for people with a sore windpipe, what we call tracheitis, where you've got a dry hacking cough which is very sore. It's quite good for croup, which children get. It's quite good for nasal congestion, but unfortunately no evidence at all that this is helpful for coronavirus.
Linda Mims, thank you for your question, Linda. Can COVID-19 be carried by insects such as mosquitoes?
Well, here's a bit of good news. Almost certainly not. What we know about coronavirus is it's a respiratory infection, and it's transmitted through droplets when people cough or sneeze, or possibly even talk within near vicinity to somebody else. The virus is transmitted to somebody else's eyes, nose, mouth, and when we touch hard surfaces where the virus has landed, we then transmit the virus to our faces. It is not thought to transmit in blood or in body fluids, and that's why we're still encouraging people to carry on donating blood. If they're frequent blood donors, we want that to continue, because there's still the same need for blood as there's always been.
Absolutely. Next question is from Rebecca Falstead.
Hi, Dr. Hilary. My question is, can you have COVID-19 without having a fever? And how can you get tested to see if you have had it? Thank you.
One of the common symptoms of COVID-19 is a fever and a persistent new dry cough. However, we know from what we've already seen around the world that some people don't develop those symptoms. They might have just a sore throat or a headache or fatigue, very minimal symptoms, and some people seem to have no symptoms whatsoever. That's what's so curious about this virus. So it's possible to not have a fever or a dry cough and still have COVID-19, but it's unusual.
Question from Angela Robinson now, who asks, is it safe to eat fish, vegetables, fruit and salad from other countries?
Yes, the virus doesn't live in the food, and it doesn't live on the food as long as it's been washed. So fresh fruit and veg, wash it under the cold running water, and when you cook the food, the virus is killed. So absolutely yes. A lot of our food comes from overseas and we depend on it.
Good question from Mohammed Bukareem, who says, I'm suffering from toothache. Can I go to the dentist?
Yes, the current guidelines for dentists is that they don't do any routine work. So they're not doing polishing and scaling. They're not doing crowns. They're not doing anything other than emergencies. And if pain is severe, it can be classed as an emergency, and you can get seen. However, if it's a mild pain, why not try paracetamol first for a day or two and see if it disappears?
Catherine Williamson says, some of the symptoms I'm reading about are similar to those I get from fibromyalgia. How can I tell the difference?
Well, some of the very common symptoms of fibromyalgia are tiredness and aching soft tissues in the body, muscles, ligaments, joints. They ache and they're stiff. There are sometimes psychological symptoms as well, such as headache and feeling low. These aren't normally common symptoms of coronavirus. You certainly feel tired and even exhausted when you have coronavirus, but usually the obvious symptoms would be a dry, persistent new cough and a temperature. So you wouldn't get a temperature normally with fibromyalgia. You'd feel fatigue and aching muscles, which you can get with coronavirus, but I think that you would be familiar with the usual symptoms of fibromyalgia and would certainly know the difference if you were exposed to COVID-19 and developed symptoms from it.
And the final question today comes from Rachel, who has quite a story, actually. She says, I have a lodger who is still going to his office job every day rather than working from home. His wife and children live in Edinburgh, and as there are no longer any flights from London to there, he drove up there to see them yesterday and is planning to return to my home on Monday night in order to return to his job. I am obeying all the rules regarding social isolation and am becoming increasingly anxious about the increased risks he is putting me under. Am I overreacting?
No, not at all. You're not overreacting. Your lodger is behaving irresponsibly. First of all, if he's not a key worker, he shouldn't be going to the office, nor should he be travelling up and down the length of the country. He should be at home, working from home if he possibly can, and not exposing you potentially to the virus that he could get from his colleagues at work or from his travels to petrol stations up and down the country. He's risking having an accident and involving emergency care people who are otherwise very busy at the moment. I think your tenant, your lodger, needs to look at his behaviour. He's flouting all the guidance, and perhaps as the landlady, the landlady should put her foot down and say unacceptable.
Well, I guess what Rachel will be worried about is potentially losing the money from him. So, Rachel, what I think in terms of tackling this, because it's one of those social issues, isn't it, is that you can say to him, and you can do this over text message or email, you can actually say that you have received medical advice and what he's doing is unsafe. And especially now that Dr. Hilary has given you that advice, because I think sometimes if you're afraid to confront an issue yourself, actually bringing someone else into the discussion can be quite helpful.
Yeah, absolutely. Look, a lot of landlords are going to be losing rent from tenants right now, but that's the way it just has to be. We have to put our collective health first and foremost, and the economy will pick up later. But we need to save lives at the moment by keeping people at home.
Exactly. Boot him out if he doesn't listen. And I guess you should also listen to the advice of Nicola Sturgeon, Scotland's First Minister, who I think put it very well, Dr. Hilary. It actually really stuck in my head when she said, if your life hasn't changed, something's going wrong here.
Yeah, absolutely. You haven't got it yet.
We need to be living differently.
Yeah.
Dr. Hilary, incredible advice as ever. Of course, Hills will be back on Monday answering more of your questions. So if you want to submit them, you can do so in lots of different ways, actually. You can go to thesun.co.uk/Dr. Hilary. You can submit them via Talk Radio's website. Or if you want to use social media and upload your question by video, which we love, you just need to use the hashtag AskDrHilary. Hilary, you're going to have a couple of days off?
I wish I could, but right now it's pretty busy, and I want to just carry on giving advice to help as many people as possible.
Well, look, keep safe yourself.
Thanks,
I know
Angie.
you're doing everything you can to reduce social interactions, which is very sensible right now. And we will talk again on Monday.